Social Security and Medicare are both programs that we have paid into over the years. And they call them entitlement programs. I look at them as programs that we've paid into and it's paid back. So to see Congress thinking about cutting those programs is very disturbing to me.
Oh, I just think it's the saddest thing that in this country that we treat those who have worked hard and saved and planned for their retirement with such, just disinterest, and to even consider using those cuts for people who have had this as a plan, as a life plan, I think is just shocking. And of course, these cuts have nothing to do with what is wrong with the budget. So it seems unfair, to say the least, that this is where they would look to do some cuts.
I guess what I think about Social Security, which started about the time I was a baby, is that it was a brilliant idea. It works beautifully. We need to preserve it and pass it on and improve it.
It's not a giveaway. It's something that we worked for, we paid for, and we deserve to have.
I think it makes little or no sense whatsoever to use Social Security as a basis for getting us out of our deficit, which is a real problem. But Social Security hasn't contributed anything to creating a deficit. It's had its own dedicated tax system since its inception, which has paid all its expenses, including the benefits and the expenses of running the program. So this is not the place to look for a way to solve the deficit problem.
We've paid all these years, every one of us, our parents, parents before us, our kids. It's part of, I think, preserving a little bit of life. It's like a savings account, and it's something we've worked for that should not be messed with.
I'm really against those cuts. I really believe that at a time that we're in, we ought to be strengthening the kinds of support systems that are available for people that are mostly in need. And so I'm real sad.
People who need Medicare and Medicaid are people who are probably, for the most part, on fixed incomes and can't really afford to fall behind the cost of living.
It's a little scary. Since I'm disabled and retired and I'm on Social Security, it scares me.
My thing would be don't cut Social Security. We have a hard enough time living nowadays just without the cost of living increases. And if you've got someone like I do living in a adult family home at a cost of $4,600 a month, we need every nickel we can get.
To me, the Social Security and Medicare system is a question of expectations. And when people have been made promises to expect it, and then those promises begin to dwindle and fade away, that's extremely problematical. And I think that the government and the legislature ought to understand that and not make any changes to either one.
What is your thought about they're talking about cutting Social Security and Medicare, some of the politicians are, as a way to reduce our federal deficit and bring our budget in line. What do you think?
Against it, you will not believe it. You know, I'm so mad that they're doing that. Yeah, I'm so against it.
Why?
Why? Because these people, earn the right to have their retirement in peace and have their Medicare, and they were promised they'll be taken care of. And now all of a sudden they want to take that away from them. That's not right. It just, I know they paid their dues and now it's time to pay them back, so.
Okay, so Medicare, and particularly Social Security, is extremely important to my husband and I. Without it, we would probably not be able to stay in our home that we had built and paid for over the last 48 years. So with me being 77 and my husband being 80, it's really important that we maintain the house and our ability to live in the community, which we're very active in. It's also important because I have friends, a very dear school friend who has Parkinson's, who needs Medicare, Medicaid. She has home health service. If she loses that, she'll be forced into a nursing home. And so both of those programs are extremely important to me and people that I know.
I've contributed to Social Security so that others could enjoy benefits who retired ahead of me. And now I expect it to be there without cuts for me. And as far as Medicare is concerned, I'm a cancer survivor. And it's very important for me, who knows when it's going to come back, that Medicare stay there for me with the current benefits.
If it weren't for Social Security, we would have no income.
Social Security and Medicare form the fundamental framework of the social contract that we decided to create in this country so many years ago and have continued to be committed to throughout my working life. They're important to what we are as America, what we decided we wanted to be as America, and what we need to be and want to be going forward.
Without Social Security, Medicare, and Medicaid, many people would be doing without.
My message is leave Social Security alone.